Thank you very much, Dr. Torres. Welcome again to this exciting webinar. Pardon me, my throat is a little bit off, so I'm going to try and accelerate this discussion just so that even my throat is saved a little bit, and hopefully we can save time. So my task is today to explore the context-specific scenario-based framework that we put together to design and help policymakers, technical experts, to explore context-specific BTB control strategies. So the important part out here was that we really were exploring, and as Francisco really nicely summarized, what the different epidemiologic conditions and contexts were and how we might be able to categorize these based on different resource settings and production systems to then try and move ourselves beyond test and slaughter. So the four scenarios are presented in the guideline document, and you'll see this at the end of the document. But I wanted to just establish perhaps a different way of viewing these scenarios, the conceptual framing, if you will. So the first part, if you look at this on the x-axis, if you can try and think about aligning different programs based on the level of existing control infrastructure, the veterinary services, as well as existing implementation programs. Is there a program? Is it well implemented? And where is it during the implementation cycle? And then also look at the type or the intensity of production systems. Are these extensive systems or somewhere mostly intensive production systems? And then on the y-axis, looking then at the prevalence level, effectively from low to high, and then establishing what might be an officially TB-free cutoff scenario, which is present. So if you then start to stratify different scenarios out here, in scenario one, you can have a system in which you've got really well-developed infrastructure, well-established control programs, as well as intensive production systems. Most of the herds, if not all of them, are below the OTF line, but occasionally you will find some breaks and you will find some areas or regions, perhaps because of wildlife or movement control or importation, or just simply those that are refractory to control that might pop up. And this might occur as well in any particular scenario. Another scenario two guidelines that we put together out here are in countries in which there's an emerging infrastructure. And out here in particular, what we're looking for are countries in which we're seeing intensification occurring, that there is some level of control that's implemented, but it's variable, and that the veterinary services are pretty good. But it's really intensification that's driving increase in prevalence, and you'll find highly intensified herds in the absence of biosecurity and control will have very, very high prevalence rates, as shown by Dr. Getnet, and we've explored elsewhere in the world. In fact, historically, it was true in Western Europe and North America prior to control programs being implemented. But a fairly large number of these will actually be pretty low, at least in the ones in which the extensive farming systems still exist. So this then begins to help us start to stratify risk, understanding where the system is and what the capabilities are and the potential for what the inputs might be. And then finally, you'll have in scenario three, which is primarily extensive-based systems, where you might again have no existing control programs. And in certain areas, you might have some herds that have middle-level prevalence, primarily, again, driven by intensification. So let's go through what these are, primarily considering as well the wildlife reservoir situation, which we labeled as scenario 4, which might occur in any of these. And so when you have an opportunity for spillover because of wildlife, that really changes the dynamic. So each of these scenarios or any of these scenarios might have a wildlife component that then helps again contextualize the epidemiologic framing of the problem here. So let's very quickly go through scenario one, here in which generally low prevalence, robust control, intensive systems. Typically, these are OTF already, and they're well-regulated farming systems with good biosecurity as well as with strong movement controls. And so the interventions in this are pretty straightforward. Maintain the test and slaughter because that's what's gotten you there. Consider certification schemes, particularly zoning and compartmentalization, in case these are not being used extensively, might help better stratify the risk and also enable the country to move forward or the region to move forward with proper certification and compartmentalization. The important consideration out here is as well, if there's a wildlife component or large herds involved, it might be possible to consider vaccination as a complementary tool. And there are countries, for example, the United Kingdom, or potentially places in the United States, certainly in Mexico, where you might want to start to explore vaccination in these systems. Scenario two, in which we're looking at these transitioning programs, transitioning dairy production systems primarily. Prevalence is often above 5%, but this is largely driven by intensive herds. So you look at intensive herds, they'll be in the 40, 50s, some will be 80, 90% animal level prevalence within a herd. But across the country, if you look at country level or region level prevalence, these because of the extensive farming systems that still might be in place, are not very high. Again, these systems are characterized by some regulatory frameworks, but it's incompletely enforced and very difficult to enforce as well in context. And again, the critical part of here is the transitioning component, transitioning to intensive, high density operations. The trick out here is when biosecurity measures are not in place, that really helps drive overall prevalence. So the interventions in these scenarios, when you, in particular, as Francisco mentioned, ensuring that there's enhanced surveillance, both ante and post-mortem, to identify the high-risk units or areas or regions. Clearly, as Dr. Getnet suggested and has been long known now, start to implement a test and segregate program, both to preserve valuable livestock and again, maintain some level of ability to, over time, start to reduce prevalence. Clearly, considering BCG vaccination and intensifying herds is looking to be a very strong possibility, particularly given the recent findings on the indirect protection that's afforded by BCG. And then a critical component would be to strengthen movement controls and ensure that there are proper farmer incentives to enable compliance mechanisms, because again, the reimbursement opportunities out here without test and cull are very different scenarios. So in scenario three, this is where there's either low or unknown prevalence, again, primarily because of weak or absent control or surveillance systems. And these are extensively farmed herd systems. Because of the fact that these are low prevalence, low density systems, they also typically are resource constrained, more resource constrained, certainly than scenarios one and two. So again, I think starting with the basic surveillance programs, as was alluded to earlier, at slaughterhouses and local markets to understand the baseline prevalence, and then incrementally start to introduce, test and segregate in high risk, high herd, high density herd settings, particularly around areas that are urban and supplying major milk sheds, including pilot vaccination trials might be needed. there's a strong need, regardless of the system, scenario 1 or 2, for capacity building, capability building, particularly on training veterinary staff and improving diagnostics capabilities, and then building the trust with the communities, because and the issue with bovine tuberculosis is that it manifests itself over a long period of time, and it's this silent disease which will, before you know it, spread pretty quickly. Again, it's the gradual development of policies, regulations, and incentives in this scenario 3 countries. And then scenario 4, pretty straightforward around wildlife reservoirs. Important to know again that this could be relevant in any context, right? Scenario 3, 2, or 1. Out here, habitat and wildlife management, excuse me, are important, as well as controlling, considering vaccination, as for example in Ireland and other United Kingdom and other places which have trialed this would be viable. And for countries, for example, such as in New Zealand, which managed its possum problem, integrating both the environmental and animal health sectors, or wildlife and animal health sectors, are really important. And a good example of that is, again, in the United States and in Michigan, for example. So I wanted to just sort of end by saying that risk stratification and understanding the context are really key for effective control. In the absence of control, over time, as herd sizes increase and intensive farming takes place, prevalence will increase. There's no real two ways about that. And so whatever interventions we're looking at, trying to bring these down to below thresholds where R naught does not increase much. And so again, the considerations are the prevalence at the starting point, the initial herd size and growth rate, knowing that there is going to be a density-dependent transmission rate increase. And then when you're going to initiate intervention become the key variables that one must consider when you're looking at the context, particularly within a herd setting or in a region setting when we're drawing up what scenarios might be most applicable. And then I'd again reinforce the point that Dr. Getnat had made around the real value. The real value of BCG appears not to be its direct protection, meaning reduction in susceptibility, but the real value of BCG might be, at least in this context of the study, which shows that it's the ability of the vaccine to prevent onward transmission. And for effective control, that's really what you need. So I think if routine calf foot vaccination is trialed out, it might help reduce the impacts of the intensification, which is really critical. So again, to recapitulate, no one size fits all. Strategies are dependent on the context. Intensification without effective controls will worsen TB, and that tailored interventions, test and segregate, capacity building, building the technical and policy frameworks are essential to stabilize, reduce the prevalence. And I do think the reassessment of the business case, and I'm put business out here, actually the economics of this is really important. Alongside with stakeholder engagement for sustainable control programs. And understanding this can only be done if we start to implement these pilot programs. I'll end very quickly by thanking a lot of my colleagues across the world who worked with this, and it's a real privilege to work with literally hundreds of colleagues around the world on this important program and funding by the Gates Foundation, the FCDO, and at PennState. So thank you very much.